if you think about cancer, cancer is like a toxic heat ultimately. And then that toxic heat is coming from or transforming from oftentimes from some other kind of heat, which is maybe like a way of saying that cancer is ultimately on some level there's some sort of inflammatory process, like there's some sort of like heat that then becomes toxic heat, right? That's often the case. There's obviously cancer is not one thing, there's different types of cancer. Usually when you have some kind of toxic heat, there's an underlying heat underneath that. And that heat, we think in Chinese medicine in terms of damp heat. We think of that in terms of, blood heat. We think of that in terms of organ heat, right? I mean, I suppose we could add to this that there's some sort of phlegm heat, just the different ways that we can think about heat, right, in Chinese medicine. The other thing to keep in mind, I think, in our strategy here is if she's making a decision to not treat it with radiation or chemotherapy, does she still want to treat it though with Chinese medicine? Meaning that the missing piece from this formula would be that we're not doing anything about trying to deal with any residual fire toxins. When somebody has a tongue like this, I think we feel really comfortable around that because there is heat and stagnation in her system. I think if here's a person that like showed a lot of signs of deficiency, your tongue was really swollen and pale, and then be like, wow, we gotta be careful doing all kind of like heat clearing for 3 to 6 months or something like that post surgery because we're gonna destroy our digestion and concerns about that. But I think when we see someone like that, it's like, okay, well maybe we want to do a round of our version of just trying to clear this toxic heat and make sure it's out of her system. To me, it's worth having something in the formula that's dealing with that. So what would that be for me with breast cancer? That's often, doing something like pugong, for example. So I like to keep some fire toxicity clearing herbs in a formula post breast cancer surgery. So I have a lot of women who are, post recovery, they're in recovery from breast cancer. And so I'm always doing these kind of fire toxin herbs. That's one piece. And then the other piece, which is often I do anyway with breast cancer, but that would be maybe potentially missing from this formula, preventing chi and blood stagnation in the chest. You are doing that because you're giving her Ho1P. You could say the Ho1P is moving chi and blood in the chest. That's a good example. I would want to have something like Dan Shen
Yeah,
to move,
that's
to move blood to the chest. And then again, like thinking about how do we ratchet this up depending on the how much we want to be doing this. Almost this is a little bit of a continuum from like Huan Pi to Dan Shen to Rushong. Is stronger than Dan Shen. Dan Shen stronger than Huan Pi. So that's something to think about in terms of Rochon is and like and again like as you get with stronger herbs there's a risk, so it's a risk reward because the risk with Rochon is that it's a little bit harder to is a lot harder to digest. It's a lot harder to digest than Danshen and Hopuan Pi easy, it's a bark. Danshen is a root, and then Rochon is a resin, and resins are just thick and sticky and harder to digest. The two pieces that I want to how do we deal with the toxic heat, right? And then the question is like, the where is it? And like what's the location? In this case, it's obviously her breast, right? Chest. So that's where we can have it be focused, right? So we say Pugong Yang, for example. So the location, and then is there some underlying source of heat that we want to also keep into consideration? And you're already doing that because on the one hand, you're dealing with blood heat, because you already had the Danshan, the H1P, but the other piece maybe, which you are also dealing with in this formula in general, is we'll call it like depressive heat, chi stagnation, in this case in the chest, right, which is causing there to be heat. So that might be like the underlying heat dynamic, and then you have the toxic heat dynamic. And then the third piece, which again you already have. So you like let's say the first piece of the strategy is to deal with the shoe pattern, maybe. Right. So you've got that, right? You're saying, okay, well, underlying here we have a woman in her 60s, liver yin deficient. There's some deficiency of her liver yin. She's blood deficient. These things I'm saying. We give her Iguan Jian to address the underlying pattern. So you got that. Number two is in this dynamic is like what would be an underlying source of heat, because cancer is never coming from deficiency. You know what I mean? Ultimately, I mean, there might be some deep deficiency, but there's got to be some sort of toxic heat process that ensues. So there's always going to be some sort of heat. And then thirdly, the dealing with fire toxicity. So those are the three pieces. And so in this formula, we definitely have the underlying pattern. We have the heat, chi stagnation, the blood stagnation, and then now you add Pugong Ying and something like that to get the fire toxicity piece. And then it's just a question of like how long you want her on this, you're watching her digestion. It's like how long is she on this part of it?